Hi, I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon operating in Aestiva Cosmetic Clinic, Saket. So it's been the end of a long tiring day of surgeries and I'm heading back home finally. So I just decided to answer some of the most frequent questions we get regarding tummy tuck versus liposuction. So the first question was, are the abdominoplasty and liposuction procedures similar? This has been asked to us by Sakshi. So Sakshi, addressing your question, these are two different procedures. Liposuction essentially just involves removal of excess fat from your tummy, whereas abdominoplasty, or known as a tummy tuck procedure, is something which includes removal of both excess skin, like loose skin after having a baby or after excessive weight loss, along with maybe some amount of liposuction. So no, these two procedures are different and are meant for different set of patients. So what do we have next? Okay, liposuction or abdominoplasty, which is the best procedure for me. So Khushbu Sharma wants to know this. So Khushbu, we'll have to determine what kind of needs you have. So suppose if you come to me and you tell me that, ma'am, I've had a baby and I've lost my weight, but the excess skin simply refuses to go, then I would say you are a candidate for a tummy tuck procedure, in which I'll be tightening your loose skin also. And if you have some fat bulges here and there, we'll be taking that out also. Especially again, if you've had a baby, then the tummy muscles tend to become loose. So we're going to be tightening all of that together. I might be repositioning your belly button. So only when I meet you, I'll be able to know what your exact requirement is, whether it's simply fat removal, which can be taken care of by a liposuction, or you have excess skin, which requires a tuck. I hope that answers your question. The next question which our patient wants to know is that a friend suggested that I need a tummy tuck and the liposuction both to get the desired result. Is it true and is it safe? So yes, there are some cases in which we have a combination of a tummy tuck and the liposuction. I would say in most cases, in 95% of cases, we would give a combination of procedures. So this will help us to address the loose skin and also take care of about the unsightly bulges which might be there at your back or at your flanks, and essentially give you the hourglass figure which we aim to achieve. Now, these are absolutely safe. In fact, recent studies do show that combining a liposuction with a tummy tuck, in fact, increases the success rate and reduces the complication of this procedure. So yes, we love to combine these procedures routinely to give the woman the hourglass shape she wants from such a procedure. So the next question is from Ria, and she is a 17-year-old girl, and she says that she's been working out regularly. So her tummy fat bothers me a lot, and is it okay to opt for liposuction at such an early age? So that's a good question. So Ria, you're the kind of person I need to meet first. I want to see how your diet regimen is like, how your exercise regimen is like, and also whether you have any other illnesses I should know of. So one of the most common reasons for weight gain is thyroid, so we need to rule that out first. Also, liposuction is a very safe surgery, but since you're 17, we need to have a word with your parents also and involve them in the procedure, planning of the procedure if need be. And we should also ensure that once the liposuction is done, if I decide to do that, that is, then you follow a routine where you take care of your diet and also stick to an exercise regimen to sustain your results. The next question is from Akshay, and Akshay says, I am unable to lose weight. Can liposuction help? This is one of my favorites. So this is a very common myth that liposuction is a weight loss procedure. It actually is not. So liposuction is good if you are just about a few kgs here and there overweight, say maybe 10 kgs maximum over your normal weight, and it's essentially a body contouring surgery. But if you're looking at losing at something like 30 to 40 kgs, then liposuction is not the procedure of choice. So first I need to know your BMI. If your BMI is anything above 35, then no, you're not a candidate for a liposuction surgery. You should opt for a bariatric surgery if at all, or choose other weight loss measures like dieting and exercise programs. So once you have lost that excess weight, then the role of surgery comes in, where I can offer you treatments for body tightening like tummy tuck or an arm lift or a thigh lift. So if you're excessively overweight, then no, liposuction is not the procedure of choice for you. The next question is by Anushka, and she asked me, why should I opt for a tummy tuck and not non-surgical options like HIFU? So Anushka, to answer your question, tummy tuck is for loose and sagging skin, which is say after delivery, after childbirth, or after excessive weight loss. HIFU is good for addressing small amounts of loose skin, or I would say moderate amount of loose skin. But if you have say an excess tire which you have developed after pregnancy and childbirth, then HIFU is not really the procedure of choice. Also, the additional benefits which a tummy tuck can give you are of tightening your muscles, which most women tend to have loose muscles after childbirth. So we also address that problem during a tummy tuck. And also, if you have some excess weight here and there, if you have fat bulges on your back, on your flanks, then we can take care using the technique of lipoabdominoplasty, which combines liposuction with your tummy tuck procedure. HIFU is good only when we require secondary tightening. So suppose we have done a liposuction and we have a minimal amount of sagging, then yes, HIFU is a procedure of choice. Also, all these non-surgical techniques require repeated sessions and are slower to show results. Shivani is asking me that her son is 2 years old. Okay, can I go for a tummy tuck? I can't afford to have a long downtime period. So Shivani, I understand with a 2-year-old it's difficult, but tummy tuck is not a kind of procedure which has a very long downtime, and honestly there is nothing like bed rest. Maybe you require to restrict your activities for about 3 to 4 days, and then you can perform all the routine activities like cooking or taking care of your child. So maybe with some kind of a minimal household help, you are fairly manageable, and you can think of getting the surgery done. Also, since your child is 2 years old, probably he or she is not on breastfeed, which is again an important criteria. The only thing at this which I want to know at this junction is whether your family is complete or whether you're planning a second baby. Because if your family is complete, then yes, we can go in for the procedure. However, if you think that you're planning another baby in the future, then I suggest that we wait for that before we plan this procedure. Simply because tummy tuck will involve tightening your muscles, taking away the excess skin, and a future pregnancy is going to affect these results and can also lead to a little bit of discomfort during pregnancy. So I hope that answers your question. So these were the few queries I was able to take up today, and I'm sure you must have got an answer to most of your doubts. And if you have any further questions, please drop it in the comment section below, and you're most welcome to visit our clinic, and I'll be happy to clarify any doubts you might have. Thank you.